Good evening, ladies and gentlemen, and welcome to one of our first, I can't say it's the first, it's probably the third webinar or fourth webinar of the year for NCAER. We've had two on the coronavirus, health systems reform, and on the vaccine and its deployment. And we've just completed another one on diverse topic of investor education and protection. So we are coming back to the coronavirus theme, another of our coronavirus briefings this evening. We are privileged to have two of our top researchers who have been leading the work on the Delhi coronavirus telephone survey, and they're going to present some really interesting and important findings from the fourth round of the survey. You'll see the timing of our surveys has been most opportune. We seem to have caught inflection points in policy or in the imposition of lockouts or the unlock 1, 2, 3, however we used to call them. So we managed to catch these moments which are particularly significant. And as you will see, they decided to catch the end of the year where there's a sense of relief, there's a sense of completion in the minds of most people, anticipation of the new year, and they very much wanted to catch that perception as well. So this survey straddled the old year and the new year. Enough said, I'll turn over to Dr. Santanu Pramanik, Senior Fellow at NCR and Deputy Director of our Innovation Center, Data Innovation Center, and Professor Sonalde Desai, Director of the Center. Neither of them need any introduction. They are both well known in their fields. We're delighted to have them. Over to both of you. Thank you.
Thank you, Dr. Shah, and good evening, everyone, and welcome to NCAER webinar. And also good morning to others who are in other parts of the world. I'm not sure who are they, but definitely Sonal is in US. So good morning, Sonal, and to all others as well. So let me share my screen. So I'll start the presentation, and then somewhere in the middle, Sonal will take over to complete other parts of the presentation. Can you see my screen?
Yes, we can.
Yeah, okay. Okay, so on behalf of NCAER National Data Innovation Center, we are delighted to be back with the findings from Delhi NCR Coronavirus Telephone Survey Round 4. And this is the graph of daily number of cases from Delhi NCR, which not only includes Delhi, but the other parts of the surrounding districts of Delhi, from Haryana, UP, and Rajasthan as well. So it's data including data from 31 districts of NCR, which is essentially our target population for this survey. And it's quite a heterogeneous sort of population, although from the name it may not sound like that. It may seem like an urban population, but that is not the case. So we have a sort of even mix of urban and rural households in this region. That's how the Delhi NCR is defined. So the round 4 of DCVTS was conducted towards the end of the last year and over a period of 10 days. And this telephone survey was implemented using the Survey CTO CATI software. The interviewers essentially downloaded the Android app, the Survey CTO app in their smartphones, and they all work from home because we haven't started field level data collection yet. So they were trained through virtual platform using Zoom, and there was a WhatsApp group which were very useful in discussing the confusions or any concerns or queries interviewers may have. Our field management team were constantly in touch with them and answering their queries all the time. That's how it all worked. So
Shantanu,
we yeah.
Shantanu, just to let people know that Catty has nothing feline about it. It's just computer-aided telephone interviewing software.
Yes, yes. And so this is the first time we have been using this Service CTO CATI software. So we resurveyed randomly selected households from this Delhi NCR region, whom we contacted in earlier rounds of DCVTS, and as well as we have contacted a part of the sample before also in our Delhi metropolitan area study, which was a face-to-face survey. And we completed interviews of about 3,200 rural and urban households with a response rate of 61%.
Is your screen stuck?
Yeah, it's stuck. Let me stop and start.
Yeah, just restart the screen share, please.
Yeah. Okay. Sorry. So this is our
We can't
timeline.
still see your screen.
Oh, okay. Let
Sorry.
me share it again.
Good, we can see it now.
Yes, sorry. Okay, so this is our timeline for all the 4 rounds of DCVTS. It's quite a journey, I mean, for the pandemic as well as for the NCAER DCVTS team. A lot of learnings and insights through after conducting these 4 rounds of DCVTS, which will be sharing, which we have shared in the past and will be sharing them today as well. So our first round was launched in early April, immediately after the first lockdown was announced. Then the second round was uh, fielded in late April when the first lockdown was extended. And the third round was administered at a time point when the unlocking phase started. Things started to open up. And then the last round, which is this one, that we have launched right before the mass vaccination started in India and around the world, actually. So the the summary of the findings from these 4 rounds of DCVTS can be summarized by this the title, that's recovery and vulnerability, divergent paths in the wake of coronavirus pandemic. I mean, that's a very nice way to very concise way to summarize the findings. It's thanks to Sonal to come up with this great title for this talk. So what do we mean by that? So let's see in this slide, what do we mean by that, the divergent path. So in last year in February, like when there was no pandemic, I mean, there were traces of coronavirus cases here and there in some states in India, but no pandemic as such in February. And our NCAER team projected a 5.6% gross value added GVA growth for the upcoming financial year at that time point. And then all of a sudden this pandemic sort of started its assault in India, and we have our first lockdown announced towards the end of March, and pretty early at the pretty early stage of the pandemic. And which was the right thing to do, I think, at that time point. And then the first round of DCVTS was launched in early April, where we have noticed that outpouring of support for lockdown among households in this region. But at the same time, we have seen that households have experienced a sudden income drop. Vast majority of households, about 85, more than 80%, I think, households reported that. And there was consistent finding across all the surveys conducted in different parts of the country at that time point. But the salaried workers and farmers were still protected at that time. And then in late April, when we have the second round, we have seen that there were high level of disease awareness, and people are following social distancing. They were taking precautions, and there were low level of risk perception as well among households in late April. At the same time, we have seen urban vulnerability, in the sense that the impact of the pandemic, as we know, is much higher in urban areas. The income decline also reported more in urban areas, but in the context of overcoming that burden, the receipt of social welfare schemes was not that high. I mean, it was much below the desired level in the urban area. So the urban poor often did not receive the benefits of the social safety nets. I mean, that's perhaps the way our safety net programs are designed. It's mainly to cater to the needs of the rural population, which is good in a normal time, but not necessarily it was ready to support the urban poor during a pandemic time. So that's what we have seen, that urban exclusion, and that continued, I think, throughout the pandemic period, which we have seen even now as well. So, and in June, when DCVTS 3 was launched, we have seen the people returning to work with some challenges. There were better prevalence of people receiving safety nets benefits. But the small businesses, they suffered a lot because of income decline, and there was hardly uh, any demand for the products for different businesses. So that actually hampered the recovery of small businesses. So now in December, as Dr. Shah also mentioned at the beginning, that there are a lot of sort of optimism, in the sense that there are less number of cases now. And I think that's mostly because of depletion of susceptible population at this time point in the pandemic, as well as there are development of vaccines, approval of vaccines, and health services also started to resume back to normal to some extent, at least for many of the health services. And employment also, there are findings from different sources which suggest that there is employment recovery happening. But at the same time, because of the income decline over a longer period of time, which may have had a lasting scar among the households in this region, and also the education of children, particularly young children, have impacted deeply during this time, which you'll see during the presentation. I mean, it has probably affected students of all age groups, but in our survey, we have considered only young students in the age group of 6 to 14 years. Okay, so now before we go into the main presentation, couple of slides on the survey and sample characteristics of our sample, just to understand the representativeness of the telephone sample. And in DCVTS 4, we have seen a response rate of 61%, which is lower than what we have seen before in DCVTS 3, as well as in the first two rounds, which was much higher because those were conducted during the lockdown period when people were at home and also not doing much work at that time. So what we found, that conducting telephone surveys during lockdown was much easier compared to this time. So getting, people's time, and their was convincing them to participate was much difficult in this round compared to the earlier rounds. So the median interview length was below 15 minutes. And also we have noticed that the respondents often wanted to rush through the interviews compared to our experience in the earlier rounds. So we have a sort of uh, indicator that we monitor, that if the interview is completed within 10 minutes, we immediately sort of talk to the interviewer and try to find out why and how that happened. So that's the sort of feedback we got, that they're not ready. Respondents don't have time now to complete a sort of 15-minute interview. So they want to finish it in 7 minutes, not more than that. Okay, so now we look at the household level characteristics of our DCVTS4 sample and compare it with the DMAS baseline sample, which was a face-to-face survey. We just want to, and usually the face-to-face survey, if a scientific sampling design is used, it leads to a more representative sample. That's the sort of experience, and literature suggests that. And we want to see how a telephone sample looks like in comparison to that. So most of the distribution match quite well, and there are more urban level attrition that we have noticed in in the telephone in DCVTS4 compared to a face-to-face survey. And it's not easy to capture caste data in telephone. That we have seen that about 10% kind of says don't know, or I mean, in face-to-face survey you can probe more and try to get the answer, but it was difficult in telephone survey. Among respondent characteristics, since so one major sort of finding is that, I mean, we have seen this in the earlier rounds as well, that it's more skewed towards male respondents, because the phone numbers, those were usually given to us, are phone numbers of male member of the household. So we couldn't reach many female respondents as we would have liked to do, but that was not the case in face-to-face survey. And also we have seen lower proportion of 60 plus respondents in telephone survey, perhaps their lack of phone use sort of behavior that indicates. Okay, so now coming to the topics I'll be covering today are related to the COVID testing and the healthcare access and vaccine hesitancy. So first, we wanted to get a sense of the self-reported testing rate and test positivity rate in this region. What we have so far is more coming from the official data. So we want to get a sense of how things are from the reports given by the respondents, households themselves. So this is the question we have in DCVTS4. We didn't want to ask it very directly, so it was asked in a after giving them a context. So and then what we found is that in 38% households, someone in that household got tested for COVID-19 during the entire pandemic period. And the testing rate is significantly higher in Delhi relative to other parts of NCR, that's UP, Haryana, and Rajasthan. And also it's higher in urban areas compared to rural parts of NCR. I mean, there's no surprises there. And we have very few respondents, about 1%, who reported unmet need for COVID tests, which essentially means that they wanted to get the test done but couldn't do it. Probably things got a lot easier with time, which was not the case at the beginning. Our survey didn't find much of those instances at all. And among the households which got the test done, in about 5.4% households, at least one member tested positive. So that's the sort of test positivity rate that we have found from our data. It is slightly differently defined because this is at the household level, whereas the test positivity is more appropriately defined at an individual level, but this gives us a sense of the test positivity rate in this area, and which is not very different when we compare it with the median test positivity rate based on the official data source. Slightly lower, I would say. It's possibly because of concerns of stigma and discrimination. So that could be one of the reasons. So this is the graph of test positivity, is the time trend starting from June 1 to December 31st in Delhi NCR, again, using all the 31 districts data. And it's about always around below 10% or so. The median is 7.6%, the official data, and we found 5.4%, which is the green dotted line in this graph. Now, that was COVID.
Santanu, just on that, going back to this slide, you are of course looking at the end of December period. So the positivity rate from official data is for this entire period, or is it just for your period?
This, in our case, the first question we asked about the testing is the ever tested. So that means the entire period.
So that's
so
what
there
you're
could
reporting.
be recall. I don't know. Recall is bias. May
No, not
be
recall. I think people would remember if they tested.
Would remember, yeah.
No,
but they may not want.
Is it? What's the time frame for both medians here? Is it the same or is it different, or?
No, it has declined definitely. Yes, towards the December or something. Yeah, you're right. So it has declined. Yeah.
Okay. All right. Sorry. Go ahead, please.
Yeah, sure. So as we know that COVID has had put a lot of pressure on our health system. So that may have disrupted the routine health services, and that has emerged as a major area of concern during this time. During the early period, there were newspaper reports which suggest, based on HMIS data, the Health Management Information System data, that there were noticeable decline in the use of maternal and child health services and immunization services during the lockdown period, when compared it with the last year's data with 2020 data. Also, WHO did a lot of assessments around the world, sort of suggesting that there's severe disruption of prevention and treatment of non-communicable diseases as well. So we want to understand the current situation, I mean, whether things have improved or not. So we have asked that in the last 3 months, that is from October to December, did you or any member of your household need to avail medical services for the following reasons? So we have a whole list of health needs, whether they needed to avail medical services for that or not, with these 4 options. Okay, so received care without much difficulty, received care with difficulty, needed but did not receive, not required. So let's keep this table and go to the graph that would be easier to visualize the findings. So this is an interesting graph. So what we see here, so first of all, the disruption is dependent upon the type of services, which means that the services that are more commonly, most households are in need of those services, such as access to medication, treatment of minor illnesses such as, say, fever, cough and cold, diarrhea, and acute respiratory infections, etc. And also maternal and child health services, immunization, delivery related services. So these are more common need for majority of the households, and the width of the bar is proportional to the number of people needed those services. Okay, so the top 3 bars kind of indicate that these are the more prevalent needs in the context of different health needs. But for these health needs, the disruption, the level of disruption is much low, as indicated by the green and the red portion of the bar. So the services that are commonly used are generally available closer to home. So probably people are able to access them much easily. So the disruption level is much lower. On the other hand, if we go down the graph and reach to the say last two bars, where the bars are much thinner, so that means say for example chronic respiratory illness or kidney diseases, smaller percentage of people need those services, need treatment for those diseases. Similarly for cardiovascular disease and cancer, but in those contexts, people have a much more difficult time to access those services. So if you look at the say cardiovascular disease or cancer, so more than 25%, so 28% of the households reported that they have difficulty in availing those services. Difficulty means they did not receive or received with difficulty. Okay, so it's more than it's about 28%. Similarly, for chronic respiratory illnesses and kidney disease, it's 23%. But these are the disease is having low prevalence, so this affected a smaller proportion of households, but these were difficult to avail during even in the last 3 months. So that's a sort of finding from this disruption in the context of healthcare services. And there could be both demand side and supply side constraints in being able to access healthcare services. So we have looked into those to understand which sort of have a major role to play in this context. So what we have seen that about 37% they experienced or they perceive that the healthcare service capacity is below the normal level. So the supply side sort of constraints seem to be bigger compared to the demand side sort of intent of availing services. So there we have seen that about 22% respondents reported that they would either avoid visiting medical facilities even now or visit only if there is an emergency. So there's some reluctance from 22% respondents, but the supply side perception seems to be bigger than that. Okay, so now in this context of mass vaccination, so vaccine hesitancy is a very important topic, and we have already seen a lot of newspaper reports. So this is just one of the clippings that appeared yesterday only. So let's see what's our findings from DCVTS 4. So, as we know that this development, testing and approval of COVID-19 vaccines have been achieved within a record time. I mean, this is something unprecedented and we have never seen that before. So this is undoubtedly a great achievement of scientists, industrialists and policymakers. But on the other hand, it might lead to vaccine hesitancy, particularly in the absence of effective communication. So that's why it's important that we deal with this issue immediately than dealing with it later. So this is the question we have in DCVTS 4. In few months, if vaccines were to be available to prevent COVID, will you be willing to take it? With these 5 options. So this is the finding we have. So I mentioned about 5 options. The options are yes, that they will take it, yes, but after a while, they are unsure about it and they will not take it because they are infected, and no, they will not take it. Basically for any other reason they will not take it. So when we consider only that group which has kind of refused to take vaccine, that's the no group, that's in pink color in the bar. Overall 20% respondents, they're kind of certain about not taking the vaccines. And there's significant rural and urban differences was observed. It's more in rural population compared to urban. And in addition to this 20%, 4% will not take it as they are already infected. I mean, we still don't know, and there is no guideline, I think, as such, that people who are infected should not take it. In fact, I think there are suggestions that they should also take vaccine because the natural immunity may wane over time. And additional 15% are unsure about taking vaccine. So if you combine all these three groups, that's the pink, blue, and the green portions of the bar, one can argue that the overall proportion of vaccine hesitancy at this time point in Delhi NCR is quite high, which is 39%. And this is much higher in Haryana part of NCR. And also we have seen that less educated respondents, which is defined as 0 to 4 years of complete education, they are more hesitant to take vaccine. And but there is no significant association with gender or age group. Uh, uh, Now, because there's this debate of vaccine, is it a public good or a private good? So in this context, we wanted to know that people's willingness to pay for vaccine. So what we have found, so this was asked to those respondents who are willing to take vaccines or unsure about it. So the sample size is smaller than the overall sample size. So about 41% respondents think that the vaccine should be provided free. And interestingly, about similar proportion of people, 40% are willing to pay as much as required for 2 doses of vaccine. So it's a kind of sort of U-shaped distribution, you can say, like majority of, I mean, there's sort of bipolarization happening. And there are understandably there are some trends which is easy to explain, like this proportion of people who are willing to pay as much as required is higher among the rich households, and people who are expecting free vaccine is significantly higher among respondents from poor economic status and casual wage workers. So there are no surprises there. Yeah, I think so. I'll now hand it over to Sonal.
Shantanu and I didn't mean to divide it up this way, but turns out that he's the bearer of good news and I'm the bearer of bad news. If on the health front, actually we have some reasonably good news in terms of ability to access healthcare or overall willingness to take vaccine and so on. When it comes to the schools, I think we are going to be facing some of the greatest challenges that we will be facing going back as we recover out of the pandemic. It almost feels to me like 2021 is likely to be a lost year for a large proportion of our students, okay? And in a variety of ways. What we had done, so what we had done was that we had interviewed roughly about of our households. We asked people how many households have children who are age 6 to 14. And then we asked about the educational experience of the youngest child in this age group by name. Now, just a reminder that when DCVTS was conducted between December 23 and January 4, most of the schools had not yet restarted after the pandemic. We have data on 1,530 children. Of that, 1,352 children were currently in school. Roughly about 8% were unable to enroll due to pandemic. And the children who were unable to enroll due to pandemic were mostly kids who would have been enrolling in the school for the first time. And often the answers we got were, naam likhana bahut mushkil ka kaam tha. Most of these children are 6 to 7 year olds. And there was just a tiny fraction of kids who were anyway out of school. Schools were very much caught unprepared for online instruction. And as a faculty member at a US university, I must tell you that US universities were also caught totally unprepared for online instruction. The question is, how do you respond to it, and how can one sort of provide some sort of an instruction? And basically what we found was that about the 40% of the children were simply not offered any online classes. And 30% were also not offered recorded lectures. There is a difference between government and private schools, and there is a difference between urban and rural areas in ability to offer online classes. Basically, what we found was that the online classes were much more likely to be offered in urban areas than in rural areas. Uh, Private and government school heterogeneity was not nearly as large as we thought it might be, and essentially insignificant, because if you just think in terms of private schools were slightly more likely to offer online education, but not very much. And I think that's because if you think about Delhi itself, Kendriya Vidyalayas are pretty good and are able to do a lot. Some of the rural one-room private schools simply cannot offer some of these facilities. And so the difference between urban and rural was much greater than that between the private and government schools. Um, in addition to the children, and remember here I'm talking about not being offered, so the bigger bar is actually worse rather than the smaller bar. And what we find is that it's not just that they were not getting online instruction. It was also sort of, there was a difference by different social groups, such as children who came from wealthier households and were enrolled in schools that were sort of more equipped to offer online classes. They were far more likely to get it than the poorer children. And the difference was pretty large, even in online classes as well as recorded classes, although there were more schools that were able to offer recorded classes. There were some differences. The problem was, frankly, the management problem and not simply technological problem. It's understandable that neither the schools nor teachers had facilities to be able to offer or record online lectures. But the things that could have been done much more easily is to ensure that the instructional materials, assignments, etc., were sent to people in their home. And they should have been able to at least use those assignments in teaching learning materials that were sent home from school. Even there, roughly a third of the children did not receive any kind of teaching materials or assignments. One of the most interesting things we found was that we had a question. Did the parents have any contact with the teachers in school in the prior 3 months? And basically what we found was that about a third of the sample had a contact at least once a month in the most of the months over these past 3 months. About a third of the sample had some contact, but not a regular one. And a third of the households basically report no contact at all with the schools. So what it tells you is that it's not simply the technological problem of offering online education. There is also a sort of a ability to mobilize school resources, organize teachers' work hours, get in touch with parents, and so on. A lot of that also sort of fell through the cracks in some form. When students were offered online instruction, a large percentage participated in it and took it pretty seriously regularly. Here, the two panels basically show you how frequently did the child participate in this online learning. And we defined regularly as taking it for at least 3 hours a day, at least 3 days a week. And you find that about 2/3 of the children, when they were given online instruction, recorded instruction, home learning materials from school, etc., pretty regularly did their homework and attended classes. Some of them did, about a 1/3 did, sometimes, and a few were basically almost never completed their work. Okay. In comparison with an organized training, which sort of comes from school, learning materials from school, homework which you have to do and submit back. Okay. When children were asked to sort of do self-study or learn via educational TV, the participation rate is much lower. So clearly the direct contact with teachers, schools matters. One exception is tuition classes, which were sort of privately, parents chose to enroll their children into private tutoring. And again, there about 2/3 of the children were pretty regular about attending their classes and getting in touch with their teachers. Again, I think this is sort of a direct contact versus sort of a passive learning through educational TV and so on. And direct contact seems to work much better. Not surprising, I'm sure. Children who did not manage to participate regularly in online classes, but the classes were offered, we looked at why is it that they did not attend the online class even though it was offered. And the problem seems to be at a large level, a lack of device. There is some sort of issue. 40% of the respondents said that lack of device was the biggest problem. About 28% of the respondents said that lack of student motivation was a problem. And then there was sort of a trickle down of responses such as, parents or child just didn't know how to operate the device or manage the online lessons and so on. I think in the listeners, all of you who have young children who are taking online classes will probably sympathize that lack of motivation can be an issue. Private tutoring. India has always had fairly significant proportion of students who go for coaching classes or private tutoring, even at very young ages. And we might think that private tutoring substitutes for what the schools are providing. Turns out that it doesn't substitute for what schools are unable to provide, but it seems to be sort of added on top of what schools are providing. So even when children are taking regular online lessons, this red bar will tell you the 20% here are basically children who are taking online lessons regularly, but not attending any tutoring classes. And this 19% just above it tells you that these are children who are taking online classes regularly and getting private tutoring. So it's fairly clear that although for some of the students who are not offered online lessons, private tutoring is making up, really private tutoring is basically layered just on top of the school education and sort of complements it in some form. It also is a bit worrisome for us when you think about it, because the children who manage to get a distance education are sort of somewhat privileged urban students coming from better households. And these are the same children who are also able to get private tutoring, sort of compounding a disadvantage for people who have been left out. And this is definitely going to be a major issue as schools begin to resume. Unevenness in the classroom has always been a problem for most of our schools. And now we are going to see even a greater heterogeneity of students and unpreparedness from students' part. Okay, let me talk a little bit about employment recovery, okay, and economic distress. We have data from a telephone survey that has been also ongoing for Delhi NCAER region, which is separate from this coronavirus study. It has been going on since March of 2019. So it allows us to do a comparison quarter on quarter what's happening to the employment. And as you can see, for both, there was a very sharp drop in employment from 88% to 62% for men between Q2 2019 and Q2 of 2020, the full lockdown period. And a recovery sort of started happening around quarter 3 and seems to be progressing very well in quarter 4 with a large proportion of men who were, employment is almost seems very similar. We see the same thing for women, where there was a sharp drop for women's employment during the lockdown phase, and then subsequently there has been a recovery. But while there is good news on the employment front, the economic scarring and income effects remain very sharp. One question we asked was, did you or any member of your household face any of the following difficulties? And then we read out each of the questions: whether somebody lost a job, whether a business closed, people who were looking for work were not able to find work or sufficient work, okay? Business incomes declined, lower crop prices, and so on. Okay, and basically what we find is that a very sharp percentage of our households experienced job losses, business closures, and other sort of economic impacts. About 80% of the household experience at least some form of economic hardship. One of the biggest, most vulnerable groups happens to be the one in which short-term emergency associated with lockdown led to lasting consequences. Okay? Where we found that basically people, the main source of household income that they had during the pandemic period had to be changed, and now they are sort of deriving their main household income from something else. It may be that the household had two occupations. There was a salaried worker bringing in an income, and there was income from cultivation. The salaried job was lost, and now they had to shift to sort of cultivation for their survival. The income losses or the primary income source loss was greatest for salaried workers and non-farm businesses, where basically 11% of the salaried income families had to shift to something else. 9% of the families where the main source of income was a non-farm business had to shift to something else. So these two groups had sort of generally relatively better paying occupations, and unfortunately losing those meant that they had to move to some other source of income. We don't see quite as much sort of transition for people who are relying on cultivation or rents, pensions, remittances, etc. About 4% of the casual wage workers had to shift to something else. Unfortunately, the big problem is, where do you go from casual work downwards, and what sort of an income source can you shift to? Okay, let's take a look at where people went from where they were. Okay? And what we find is that among the this is sort of a primary income source before the pandemic and primary income source now. You would expect that most of the people who are in sort of stable position would remain on the diagonal. Okay? It is the off diagonal that we really need to worry about. Sorry. It's the off diagonals that we need to worry about. And what we find is that people who had salaried work, about 4% shifted down to family farming or cultivation. About 3% became casual wage laborers, okay? And about 3% actually have no source of income. They lost their job, there is nothing else. Okay? Similarly, for people who had no non-farm business, 88% were able to retain their work, but 3% shifted to some sort of a petty job, as gave up own business and started working in somebody else's business. 3% shifted into casual wage work, and a substantial percentage don't have any other source of income. These numbers are very small, The numbers on diagonal are the ones which are, people who stay within a sort of a stable income source. But the off diagonals are the ones really who are experiencing tremendous economic distress. Every time we talk about people changing income source, you sort of wonder whether this transformation is really positive or negative. People might have moved to a better job. Okay, people might have moved from a salaried work to start their own business and are doing really well. So what we also wanted to see was to see if these are the households which are also experiencing major economic distress. And we have two markers of distress that I want you to look at. One is, in the past 30 days, was there any time when you or others in your household did not have enough food to eat because of lack of money or other resources, or went hungry? And in the past 30 days, did you or any member of your household borrow money to manage day-to-day expenses in order to survive? And basically, what we find is that the proportion of people who stayed in the same house occupation are considerably less likely to report hunger than people who had to change their occupation or lost their occupation. Similarly, those were also the households which were much more likely to borrow for day-to-day consumption or subsistence. So these two markers of economic distress are particularly worrisome for people who lost jobs, had a business closure, were unable to find sufficient days of work as casual wage laborers. Let me look at each of these occupations by turn to see, what's going on with them. So we asked people, what are the reasons for change for the losing their main source of income? And a large percentage told us that they lost their job. Over 20% suggest that the business closed. Over 10% say no work is available, etc. Okay? So business closure, lack of work, losing a job are some of the big reasons. What's happening to job? And what we would really like here is to look at it from employer perspective as to what's happening to employers that sort of these retrenchments might be taking place. We do not have any data to be able to tell you that. We do have some of the households, however, that are sort of experiencing this occupation changes. And if we look at who are the people who are experiencing the biggest changes, we see that there are more changes in urban areas. Okay? There are more changes among the poorest sections of the households, among scheduled castes, etc. But I do want to warn you that none of these differences are statistically significant because our sample of households that lost their occupation is very small, only 217 households. So this is indicative. This would be something that would suggest future research, but this would not be something on which we would want to draw any firm conclusions. Salary workers who continued to work, okay, or who retained their job are fortunate. For all of us who complain about the pandemic, I always feel that, we are fortunate that we still have a job, and salary workers who retained their jobs were certainly fortunate. Nonetheless, their fortune does not mean that they continue to receive full salary throughout this period. We asked in November, did you receive your full salary, partial salary, didn't get any salary yet? And what we find is that only about 76% of these salaried workers continue to receive their full salary. About 15% received their partial salary. Interestingly, most of these people who did not receive their full salary, okay, were actually working from their work site on a daily basis. So it's not that they were not working sufficient number of days. They were working, but they did not. They did experience some sort of a salary reduction. Casual wage laborers had a similar story where they found that 44% of the casual laborers are getting a lower daily wage rate than the people than before the pandemic. Okay, there is a small, very, very small percentage which say they are also getting somewhat higher wage rate. Okay, the salary decline was slightly greater for agricultural workers than for construction workers, but this difference is very minor. So what we have here is a story of income loss while employment recovery is taking place. Okay. We also wanted to know a little bit about the employer perspective. And so what we did was we asked the small business owners and farmers in our sample, do you usually hire people for operating your business? And do you still have as many employees as you had before the coronavirus pandemic? For farmers, we basically asked in Kharif season, did you hire any laborers for agricultural work? And if they didn't hire, what was the main reason for not hiring? So what we can do is we can look at businesses that used to hire and farmers that needed to hire because they did have need for labor. How many of them continue to hire at the same level as they did before? So what we find here is that about 27% of the small business owners are hiring fewer employees and 12% have hired none, although they used to hire in pre-pandemic period. And about 10% of the farmers hired fewer laborers and 18% hired none. I should note again that we are looking at a very small sample and a result should be treated as somewhat indicative rather than something to hang our hat on. But we do find that clearly employers are hiring fewer people. Farmers who are hiring fewer laborers often find that there was more family labor available. This might well be the displaced household members from other sectors. You know, one household member lost his job and now is working on family farm, displacing agricultural laborer who might have been hired otherwise. Small businesses are also suffering from a lower demand for their products and a lower business income. About 75% of the small business owners said that there was a lower demand for their products. About 80% said that they have lower business income compared to pre-pandemic period. Again, I note that we don't have the magnitude of how much this decline is. We simply know whether it was worse, better, or the same. Farm households are also seem to be suffering from income drop. Overall, our past DCVTS data have shown that cultivators were relatively immune because lockdown did not affect them very much in terms of being able to sow and harvest and continue their activities. They have been able of clearly offering jobs to unemployed family members. But it looked, and on sort of ability to get seeds, fertilizers, etc., we didn't see a major negative impact. However, roughly half of the sample said that the selling price of the Kharif crops was lower than usual. I personally found this puzzling. I don't have very good explanation for why the selling price might be lower. However, the wholesale price index data also shows that the December 2020 index numbers are substantially lower than December 2019 index numbers for some of the primary crops in our area, which include wheat, paddy, jawar, bajra, etc. It may be that there is a difference in trend between MSP and farm gate prices, possibly due to logistical challenges. I just offer this as something that's sort of a cursory observation from a telephone survey without in-depth data, but this may require future research to figure out what exactly is going on. Our two markers of distress whether you experience hunger or not, and whether their household had to incur debt in order to meet day-to-day expenses. We find that the biggest level of distress seems to be among casual workers, where more than 20% experience hunger over the past month, and about 60% had to borrow money in order to survive. Okay. Households where there was no income source at all, both hunger and borrowing were much higher than before. My last substantive slide basically shows that over the period, there was a lot of emphasis in our prior surveys on safety nets, because that's when new programs were being rolled out. Between June and now, no major programs have been rolled out, except so there has been an expansion in NREGA. We find that about 50% of the households received additional rations in November, and 30% of the children in government school received grains or food in lieu of midday meal. Among our rural sample, only about 10% received NREGA work or cash in lieu of work. And for the households that received work, a very small sample, the average days received between April and December is about 34. We find that the urban households are still more likely to be excluded from rations, etc. And NREGA is obviously not available to the urban households, so the urban exclusion continues to persist. Just to sum up what we have found encouraging news on a variety of fronts. And again, that's all Santanu's purview, where we find that COVID prevalence rates that we see from household survey seem to match the low recorded cases in statistics. As a great skeptic of many statistics, I actually find this a little bit reassuring, because I have worried that perhaps our low recorded case rate and low recorded death rate in India might be an underestimate. And the household data seem to be closer to the official statistics in this. We do find that there is vaccine hesitancy, and it is worrisome. But frankly, I've been looking at a lot of developed country data, and in India, vaccine hesitancy is lower than in places like UK or United States. And access to routine healthcare was impacted by the pandemic, but the impact was modest, although the impact was greater for some of the more chronic care, which may require travel outside of local region in order to get care. And employment seems to be recovering. On the other hand, the discouragement news are that household incomes are severely impacted for almost all occupational categories. And this may have a longer term downstream impact on a variety of factors, such as purchasing ability, debt, and perhaps the household's behaviors may change drastically. Households that lost their jobs are very, very vulnerable to hunger and death. And schools have really struggled hard to cope with distance education, but have not been able to keep up, even in an advanced region like Delhi and NCR. So one wonders what's happening in hinterland. With that, I would like to end by thanking some of my colleagues and team members. We have a large team of people who have participated intensively in questionnaire design, in training and field management, in quality control and remote monitoring. Thank you, friends and colleagues. It's been a joy working with you, and particularly coming up with a research strategy that meets the current needs where a face-to-face interviewing is not possible. Thank you. I will stop sharing screen here and turn it over to you, Shekhar. Shekhar, you're muted.
Pardon me. Apologies. Now, I was just saying that thank you to Sonal and Shantanu for really a remarkable and timely, as we've said before, piece of work. Obviously, there's going to be a lot more done on these data. This is just the first exposure and the first release. Already from the first three surveys, more intense research papers are being written, and those obviously will be also available over time. I think your results on vaccine hesitancy, the alternate health issues, and I think most important, the education implications across the board are really worth thinking about, worth pondering over, and potentially deciding whether there are important policy changes and important decisions to be taken. For example, essentially saying that people will repeat their school year, or at least some part of it, or there's going to be accelerated learning where you will simply not promote an entire set of students to the next grade, because there are critical breakpoints in K-12 education where if you haven't caught on to the previous year's curriculum and have mastered it, you start getting blinded in the next year if the curriculum doesn't change. So there are going to be profound implications, as I think many have said, that our HRD ministry, NCERT, and others will have to think about in terms of what will be the curriculum for the coming year when schools now are expected to open, at least at the senior levels. So this is going to be a very important set of discussions that will happen. We have a number of questions in the Q&A box. Both of you can see it. I think I see Shantanu having already indicated that he wanted to start by answering at least one question live. So Shantanu, why don't you take that, and then between Sonal and you, and if you want to bring in anybody else from your team, we are happy to do that as well. So Shantanu.
Yeah, I think the test positivity rate is based on the sample who have tested sometime in the last 10 months or so. So it's based on that sample, not the overall sample. So
that's the same as the official data on positivity
exactly
would be.
same as the
It
way
only obviously captures those who are positive amongst those who went and got themselves tested.
Yeah.
Do you want to answer any of the other questions online as well? Amrish Dongre, and I can read them out. Are online classes and recorded lectures overlapping, or are they mutually exclusive? And what would be the percentage of households or children receiving at least some sort of education? I don't know if you have the answer to the second one, but maybe it's a clarificatory question on the first one.
Amrish, online classes and recorded lectures are not mutually exclusive. However, they are highly overlapping. So I don't have an answer off the top of my head for your what percentage of children receiving at least some sort of online education, but I believe it's only about 5 percentage point more than. So there are only about 5% children who don't get online classes but get recorded lectures.
Yeah, so I just did a quick calculation. So about 25% who neither received online classes nor recorded lecture from schools. So it's the individual proportion, as Sonal mentioned, was I think 37%, 30% for each of those. But children who didn't receive either of them is 25%.
Sonal, you want to take on some other questions? I think you're about to type an answer, but you could just as well take it live from Shringanatha Raju Yera.
Let me take that directly. So, first question, expenditure on education remained the same or has it reduced? We unfortunately did not collect data on expenditure on education. We have been finding that overall collecting data on income, expenditure, etc. on phone is pretty difficult. And so this was something we did not collect. Second, 11% of the salaried lost their jobs. How is it that only 2% experience reduction in their incomes? This is for people who remain employed, that we are looking at reduction in their incomes, but 24% of the salaried workers actually received only partial pay. As you look at some of the very specifically, when we slice the data to look at only people who retain their job and continue to work as salaried workers. Does that answer your question?
I'm sure it does. We can, if Mr. Yera wants to come back, he can type in a question again. I have a question from Soman Majumdar. Is there evidence of she-cession as being posited around the world? And certainly in the US, you have evidence, strong evidence of that, that the pandemic has disproportionately hurt women, both those in the household, those employed. Across the world, we are seeing this. Sonal?
Mr. Majumdar, we have done actually a tremendous, quite a serious in-depth work on this, which I haven't presented here from the employment survey that we have been doing. And what we have found is that there is a very interesting observation for India, for our sample at least, in that we don't see as big an impact of a pandemic lockdown on women's employment as or disproportionate impact as we might have seen elsewhere, but for actually not a very good reason. Basically, people who were self-employed, people who worked as farmers on family farms, looking after livestock, own small micro businesses, were able to return to work much sooner than wage workers. And women were predominantly located in this self-employment. And so they were less affected because of the composition of sectoral work rather than the gender disparity. When we compare wage workers to wage workers, women are far more likely to be affected than men, as we see around the world. Santanu, do you want to take Ghosh's question, 60% response rate?
Yeah. So this is basically the response rate among all the telephone numbers. And when we only considered the telephone numbers where we were able to make any contact, the response rate is much higher, which is around 83%, I think. Yeah.
Debolina Kundu has a question about whether you asked households if the out-of-school children would be willing to go back to school when normal schooling resumes. Is there hesitation and apprehension about this?
Debolina, we did not ask this question, and I have sort of wondered about it. I think that there is a critical age when children enter school. And 6 and 7-year-old who should have been in school are not currently in school. Would they hesitate to go as a new students as 8-year-olds? And my hope is that schools would make special outreach to ensure that age does not become a factor within classroom setting to be able to deal with it. I do wonder what will happen, and I think that one of the issues that might sort of come up might be that RTE requires that children be placed in age appropriate classroom rather than knowledge appropriate classroom. Would this be a requirement we might have to change going forward for at least 1 year or not? I think these are going to be very serious educational questions that the policy will have to address. Thank you.
I know you didn't ask this question, but would it have, and would it be worthwhile asking it in some future round, though I'm not sure the timing of this, but the hard dilemma that I suspect parents will see between allowing their children to be promoted to the next class versus holding them back and having them go through a full year or at least some portion of a year of the classes that they missed and the grade that they missed. That's a tough choice that policymakers will have to make, and if we had data on how households felt about it, obviously we need a much larger sample, a national sample. Maybe there'll be regional differences as well, but it's an interesting question to ask.
It's a really interesting question, Shekhar. It kind of reminds me of some of the interesting work Lok Jumbish in Rajasthan had done, which was basically to teach girls in 1 year in residential setting what they might have otherwise learned in 4 years. Could we think in terms of some intense educational program given where we are um, over the first 3 4 months when schools return, regardless of other factors?
Yeah, so as one thinks about it more, this thought should have come to us in May, June, where already curricular material could have started getting prepared for this intense immersion in all the classes that people would have missed. And I, I suspect that we were just so caught up in the day to day crisis management that nobody was thinking what happens when we actually have a vaccine and we are able to lead normal lives. How are we going to overcome this huge gap? And we could have spent the last 4 or 5 months preparing for such an intense immersion kind of program and catch-up program. I suspect we'll learn for the next pandemic.
Well, I think though, I'm just thinking that this is a good conversation because it is mid-January. There is still 3 or 4 months to actually, in the current school year, before the new school year begins in North India and for Western and South India, at least until June. Uh, this would be something really worthwhile.
It's something we should probably write to the chairman of CBSE and also ministry, because I think it's not, I haven't heard discussion of this, by the way. And clearly our discussion is throwing it up as a very important remedial education, kind of intense immersion. And agencies like our sister, we work together a lot, Pratham and others who do remedial education would have a ton of experience on how best to do this. This might be something worth thinking about, given that it's so important to our children and to human capital accumulation over time.
Thank you.
There's another question from Majumdar, Soman Majumdar. Observation for wage labor is that women are more vulnerable to be paid lower wage or short change given labor market abnormality during the pandemic. I should also mention that Shripto Mandal made the observation that like the high frequency data that CMIE has put out on employment, where they say that the job losses may not be so great as the income losses. So this also relates to the same question. And I think you in your announcement had talked about a K-shaped recovery with both households at the top of the income pyramid suffering far less than households at the bottom, and similarly large businesses now acquiring market share from informal and MSME firms who have actually suffered disproportionately. So I think this ties into a story which is in the title of your presentation today about diverging paths. And indeed, I'll make the announcement a little later, but we will have a seminal lecture by the chief economist of the World Bank, of the IMF, who is talking about averting global divergence and how best to do that. So it also applies across countries, but certainly applies within a country. Any thoughts on that, Sonal and Shantanu?
I think this is definitely a challenge because, as we can see, a large proportion of small businesses, our sample captures micro business owners. We don't capture the large industries, okay? And clearly, they seem to be experiencing both a lack of demand for what they produce and lower incomes, okay? Once a business closes, it closes. It's not something that it's very easy to reopen. Okay? So I think that some of these losses we are going to see at the bottom of the pyramid are going to be very large and very long lasting. Okay? Debt that is acquired during this period, okay, it's going to take a while for people to pay back. If the nutritional impacts take place, that's going to be actually long lasting, and not very easy to sort of recover from. So, in some sense, I think that we may be seeing some positive impacts at the top end of our economic distribution, both at individual level and at industry level. We may also be seeing some very significant negative impact at the bottom for micro enterprises, salaried workers in those enterprises, and so on. I
Shantanu?
Yeah, one thing just like to add. So interesting findings from this round about the salaried workers, because in our earlier rounds we have seen that salaried workers and farmers are more protected. But I think what happened perhaps that once the salaried worker loses their job, as they did sometime during the pandemic, it's perhaps a lot difficult for them to get back to work, to find another salaried job, given that it continued, the situation continued for a longer time. Whereas because the economic activities have started and things started to open up, the casual wage workers, probably it was much easier to find job, which was not easy for salaried workers when they lost their job during this time.
Okay, I see one more question from Shruti Sriram about whether you asked questions about migrant laborers and their families.
Shruti, our survey has not been a very good survey for migrant labor issues, largely because the sample that we have drawn comes from the baseline sample that was collected more than a year ago, before the pandemic. And those people have been repeatedly interviewed, so they tend to be a little more stable. We did, however, find that there was some portion of our sample which had migrated out of the area, and we did not include them in this particular interview, but we have a number. And I think Santanu will probably remember it better than me about what was the number of people who were out.
Yeah, I think about 75 households we found that they are not currently living in Delhi NCR. So we have tried to sort of record those numbers only. We haven't asked any questions to them, but yeah, that's the sort of, yeah.
But our sample is about 3,200 households, so 75 is a relatively small number.
Okay, we are very close to our ending time. Any final comments from either of you on what the future holds, or maybe some reporting from the earlier surveys, more intense work that you have done that kind of is a harbinger of what is to come from DCVTS 4? I think you have really incredible results on hesitancy and a range of other things. And of course, we want to get as much of this evidence out to the public and to policymakers.
To me, it feels like we should be using what we know of pandemic to rethink the safety net processes that we put in place. Okay? Our safety nets have historically been designed around what I'd like to term sort of an accident of birth. We try to create safety nets for people who are born in rural areas, who come from sort of scheduled caste, scheduled tribe households, a sort of a notion of long-term disadvantage. And what we are dealing with now is not just a long-term disadvantage, and it's not that that doesn't matter, but also that there can be sort of a accidental disadvantage, or that also takes place through things like pandemics. How would we address a safety net system during those periods? And it seems that in some ways, some of the difficulties that we are facing is that we have been trying to target individuals, and we may want to think in terms of targeting areas. Okay? Pandemic struck harder in certain areas. Those were the districts we designed as red zones. This is where the lockdown occurred. Well, that is where our safety net should have been. We should have had an ability to deliver safety net and emphasize it immediately post-pandemic. When flood occurs, when a drought occurs, these are all again sort of geographically bounded events. We shouldn't at that point trying to target individuals within those geographies. We should be giving safety nets out to everyone. The question is, how do we connect individuals? How do we deliver those safety nets? And there, actually, I think India did well. Our Aadhaar-based linked bank accounts and longer-term registries such as PM Kisan registration, Jan Dhan Yojana registration, allowed us to push cash out much faster than it did United States. Okay? So thinking in terms of both geographically structured safety nets and an ability to push out cash quickly, okay, would be something we might want to take up as a takeaway lesson to think about.
Excellent. Shantanu, any last words, and then we'll end.
No, we just hope that our policymakers handle the vaccine hesitancy issue with greater care, particularly when the mass vaccine. I mean, now we have a specific section of the population is being vaccinated. So still we have time to ensure that when we start vaccinating the mass population, we have very clear messages about what to expect, where to go, and how many doses to get, and what are the side effects, how to deal with them, and what are the financial risks of facing any adverse event following vaccination, etc. So those are the key issues.
Okay, well, let me thank both of you profusely and the entire team. We didn't put up their names this time, but they know who. Maybe you did. I missed that. But anyway, they all know who they are, and we thank them profusely. This is tremendous work. Those in the field. We must not forget our interviewers who stuck to their phones throughout this process. It's a lot of hard work, and you get a lot of rejection. So there's a lot of emotional drain that's involved in this as well. And I want to thank the entire Data Innovation Center team for this. I want to take the opportunity to thank the Gates Foundation that is supporting this work. It's really a superb demonstration of how support that is sort of done in a context can be reused in such a dramatic way, responding to the situation that we are faced with. I thank all our attendees who have been listening in. Thank you for all your questions. They've been great, and we look forward to meeting you again. I'd just like to announce that there will be a webinar on Friday, this coming Friday at the same time, 6:30. I'm sorry, it's at 11 in the morning. Apologies. And this is reporting on a similar telephone survey focused on the pandemic, but covering 4 districts, 2 in Odisha and 2 in Uttar Pradesh. And my colleague, Mr. P.K. Ghosh, along with our collaborators from the Nozzle Institute of Global Health at the University of Melbourne, will be presenting the results from that survey. So do please join us. You would have received an invitation. It'll also be in the upcoming events box on the NCAER website. And then, as I said, next week, there is the C.D. Deshmukh lecture for 2021, when Dr. Geeta Gopinath, the chief economist of the IMF, will be talking about global economic development and events, and of course how the global community can avert economic divergence and great divergence during the recovery from the pandemic. Prior to that, on the 27th, we'll also have a webinar with Shudipto Mandal, Sajid Chinoy, and Usha Thorat, all prominent macro and monetary economists, talking about the macro situation as the country anticipates the new budget that will be released in Parliament on the 1st of February. With that, let me say good night to everybody. Thank you for joining us, and please stay safe. And we look forward to seeing you again at the next webinar that NCR will be hosting. Good night all, and stay safe. Bye-bye.